Hi, everyone. Good afternoon, good morning, good day, wherever you are and whenever you're watching this. Thanks so much for being with us. My name is Wendy Cadge, and on behalf of the Chaplaincy Innovation Lab, I'm really thrilled to welcome you to this webinar that we are co-hosting with Cedars Sinai Hospital on the subject of diversity, equity, and inclusion in spiritual care. The webinar is being recorded, and the recording will be sent to all of you who registered for this event afterwards, so that you're welcome to share it. It will also be available on the website of the Chaplaincy Innovation Lab. Before I do the introductions of our esteemed panelists, Michael, you want to talk about tech?
Yeah, thank you, Wendy. I'll just say one more time, because this is the #1 question we get. This is being recorded. So if you miss a point or whatever, don't worry about it. You can always come back and watch it anytime you want. This will live permanently online after this. So there's plenty of time to go back and watch. At the end of the presentations, we'll have a Q&A session. So as questions occur to you, you can use the question function on your control panel over there. We'll get all those questions. We'll go into the hopper, so to speak. We've got a good sized crowd today, so we're not gonna be able to get to every question, but we will get to as many as we possibly can. And then if you have any sort of technical issues, you can feel free to send me a message. I'll still be here. I'm gonna turn my webcam off, but I'll still be here. So if you have technical issues or anything else, please do let me know. Thank you all. Enjoy.
Super. All right, so I have these beautiful bios of all of our panelists that take up 2 full pages. And in lieu of reading you 2 full pages, I'm just going to tell you the first sentence with apologies and thanks to the panelists for understanding. And our group will speak in the order that I'm going to introduce them. So Marilyn Barnes is going to start us off. She is the Vice President for Mission and Spiritual Care at Advocate Aurora in Illinois. Kelsey White will partner with her. Kelsey is a chaplain at Norton Healthcare in Louisville, Kentucky, and a research assistant at the University of Louisville's Center for Health Organizational Transformation, where she's also a doctoral candidate. Danielle Buhuro will come next. She is an ACPE certified educator, currently serving at Advocate South Suburban and Trinity Hospitals. José Cedillo will come next, who is ordained with the Church of God, a board-certified chaplain with the Association of Professional Chaplains, and a certified educator with ACPE. And then Tamara Day, who is the Associate Director of Clinical Pastoral Education at the UNC Hospitals and an ACPE educator. We're thrilled that Christina Shu will moderate our discussion and do her best to get to as many of your questions as we can. Christina is the lead interfaith chaplain at Cedars Sinai, who again, we're really thrilled to co-sponsor this webinar with. Marilyn, start us off.
Thank you, Wendy. So because little was known about the demographics of chaplaincy, our study, Mapping the Healthcare Chaplaincy Workforce, a Baseline Description, was supported by the Association of Clinical Pastoral Education 2017 Innovation Grant Award. For this study, Kelsey and I collaborated with Wendy Cadge and George Fachette and partnered with leadership and staff from APC, NACC, NAJC, and ACPE, all the alphabet soup in chaplaincy. Our study aimed to answer 5 questions. What are the demographic characteristics of members of the main professional chaplaincy organizations? What are the demographic characteristics of board-certified chaplains? What are the demographic characteristics of the Association of Clinical Pastoral Education, certified educators, and certified educator candidates? What are the demographic characteristics of individual training in clinical pastoral education to become professional chaplains? And what are the demographic characteristics of users of healthcare and hospitalized individuals? Kelsey will share an overview of our methods and results for the study. Kelsey?
Thanks, Marilyn. Know that you guys can find this article in the Journal of Healthcare Chaplaincy if some of this stuff misses you as we go through it. So what we did is we took the de-identified membership directories of the organizations Marilyn named, APC, NACC, NAJC, and did a cross-sectional kind of descriptive peek at all of the members. We focused on those that did not identify as retired or students, so we just assumed that we would capture the students with the ACPE data. So in terms of the professional chaplaincy organization, we really focused on the active ones, the active members. We also took ACPE student demographic information from a 2016 unit level data set And we narrowed that down to focus on those doing a level 2 unit between May and August to proxy for chaplains training to go into chaplaincy. There really is no way to indicate who those are and who aren't going into chaplaincy. So we focused on those doing a level 2. And then we also used a data set that had demographic and characteristics about educators and clinical educator candidates from 2016. The variables we looked at were age, gender, race, ethnicity, the organization that employed the person, their certification type, their geographical region, and of course, religious affiliation. Now, what did we find? You'll follow me, but not as much as we wanted. So when we set out to do this, we really hoped to find something exciting and to do some more inferential and advanced analyses on these data sets, but we couldn't. And you'll see why as I go through some of these things. When we looked at chaplains in general, so the members of those primary organizations, not the education organizations, most chaplains were between 45 and 64 years old, identified as mainline Protestant or Catholic. About 65% identified as white. And then there was an equal split between those who identified as male and female. 49.5% were female and 48.2% were male. But if you looked only at APC, those were predominantly male chaplains there with about a 50% there. The same kind of trends persisted when you looked at the group of those certified compared to those not certified. However, there was a lot of missing information. When we thought about the implications regarding professional chaplains, we raised concerns about the aging workforce and the positions that will become vacant as the baby boomer generation retires. We were pretty surprised about the equal distribution of gender among the professional chaplains. And with regards to race and ethnicity, it's really hard to discuss because of the missing data. About 20% of the members in the directories did not report a race or ethnicity, or it was missing. Now, when we took a more specific look at students and educators, they had a wider variety, primarily students, and a wider variation among demographic characteristics. Although most students were still identifying as between 45 and 64 years old, the second largest proportion were under 44 years old. In contrast, professional chaplains were older than 64 years old. The sample of students remained predominantly male at 50.8%, although a good split. And then most identified as evangelical Protestant as 34.4%. And then the mainline Protestant proportion was about 33%. Students were predominantly white, but had a higher proportion of non-white identifying individuals, specifically, or more specifically within the group of those who identified as African American, 22.5% identified as such. Educators, on the other hand, had the greatest amount of missing information. We can look at CECs, those who are certified educator candidates, and they actually resemble students more than they look like professional chaplains. Again, it's hard to make any assumption because of the missing information. They were closer to students in terms of age, religious affiliation, the largest proportion identified as evangelical Protestant, and race. 26.7% of CECs identified as African American. When you think about the group of professional chaplains, there was only about a 9 to 10% of those that identified as such. Educators, on the other hand, appear as if they are older than even active chaplains. Again, missing data with the educators is the biggest challenge. There is very little information in the data set we had and can't say much about how that group really resembles in terms of demographics. The same implications can be said for students and educators as they were for professional chaplains. There is an age-related challenge as the chaplain workforce continues to age. Is our incoming workforce going to be able to fill the gaps for those that retire in the baby boomer generation? We also wondered about the gap between chaplaincy training and becoming an active chaplain in terms of religious identity. Why do so many identify as evangelical during education, even in CECs? Do they change the religious identification, or do those folks leave the profession? Race and ethnicity of chaplains also presents a complicated picture. We know very little, but it seems like, especially in terms of education, the CECs have an increased proportion of African American identifying individual that may highlight one changing workforce dynamic, or potentially a pathway we're creating for those who identify as African American going through training and into either chaplaincy or chaplaincy education. Again, the missing data really prohibited us from making any assumptions or doing any more complex analyses. However, we now have a small snapshot of the areas that really warrant more research.
Thanks, Kelsey. So an outcome of our analysis was the recommendation of a 3-year, 2-phase implementation plan. The first phase focuses on establishing a unified database of the chaplaincy workforce. The recommendation offers that the organizations combine their efforts, creating a consistent and comprehensive collection of member data across all the professional and educational organizations. This would maximize usability of the data and minimize duplication of efforts. Chaplaincy leaders would be able to analyze trends in demographics, religious affiliation, and workforce changes and compare the data with a national data set. Once the database infrastructure is established, phase 2 would take an estimated 24 months and include updating and collecting individual level data. Some of the recommended data categories included the same member type category definitions across all the organizations, master's degree type, total CPE units, specialization and residency, certification type, employer type, position type, and primary clinical caseload. Finally, a recommendation centered around determining the demand of chaplains. For example, gathering data on how many full-time chaplains or per diem chaplains are in an organization, the number of FTE positions occupied and vacant, and the existence of a CPE center or CPE unit offerings. As Kelsey said, this research mapping the healthcare chaplaincy workforce, a baseline description, which was published in February of this year, can be found in the Journal of Healthcare Chaplaincy. Danielle, we will hand it over to you.
Thank you, Marilyn. I'm so excited to be here. A dynamic that we want to speak about when we talk about diversity, equity, and inclusion, we want to think about the ways in which our CPE programming can be more just, in particular to CPE students who are persons of color. For the sake of time, I'm going to give some strategies and interventions, particularly for working with African American CPE students specifically. First and foremost, we would like to invite you as a certified educator in ACPE to think about how many African American CPE students does your programming accept during these units. We're discovering that many CPE units have small numbers of African American students being accepted into programs, and sometimes units that have no African American students at all accepted into these programs. And so first, we'd like to invite you to rethink, how are you marketing to prospective African American CPE applicants, and what is your interview and acceptance process to accept African American CPE students in particular in your programming. Next, our second invitation is to have you think about what is your specific curriculum. Oftentimes in CPE education, our curriculum is primarily supported by European American male heterosexual authors. And so we invite you to think about maybe including African American authors, for example, I hope you have pen and paper handy, because I'd like to just list a few African American resources that you could add to your CPE curriculum for both level 1 and level 2 programming. So, for example, we invite you to think about adding The Cross and the Lynching Tree by James Cone, Too Heavy a Yoke by Shaniqua Walker Barnes, Our Lives Matter by Pamela Lightsey, African American Pastoral Care by Edward Wimberly, Medical Apartheid by Harriet Washington, and a wonderful resource entitled Intersectionality by Patricia Hill Collins. There's also a wonderful New York Times bestseller, Spiritual Care in the Age of Black Lives Matter by me. Sorry for the shameless plug. We also would invite you to think about particular movies that could be used as wonderful reflective pieces in the CPE group that specifically talk about racism. So Netflix has this phenomenal series that would be wonderful in a CPE curriculum entitled The Black Lives Matter Collection, where you could do a wonderful reflection on such movies as 13, When They See Us, I Am Not Your Negro, Fruitvale Station, Moonlight, and tons of other programmings under this. And so we also would invite you to think about ways in which you could add diverse movies as reflective pieces in the process. Last but not least, we would invite you to think about offering a variety of CPE programming that meets the needs of a particular group of people. Let me give you an example. Many African American CPE students have to manage working full-time jobs in addition to taking CPE. So what would it look like to offer CPE programming where group sessions occur at night or on the weekends so that persons can still attend to full-time jobs? Also, many African American persons take care of children or elderly parents. What would it look like to offer more online CPE programming where persons can stay home and monitor or care for children or elderly parents and still attend group sessions? We'd also invite you to think about many African American persons struggle with taking CPE because they cannot afford the tuition costs. So how do you offer tuition scholarships for many African American CPE students who otherwise would not be able to take a unit of CPE? Last but not least, we want to talk about how can we be creative in the type of clinical sites that we offer in a unit. So in addition to working at a hospital-based institution, what would it look like to let students also work at non-hospital-based institutions or non-clinical-based institutions, such as a social service organization or a social justice activism program? Many of our African American clergy have expressed interest in understanding their pastoral identity and calls as being maybe outside of pastoral leadership in a parish or as a chaplain in a hospital. And so how can our clinical pastoral education also be creative and innovative for persons who may decide or discern, I have a call to be a social justice activist? And so we invite our ACPE certified educators to really begin to rethink how we understand our clinical pastoral education units and programmings. And also not be afraid to reflect on experiences outside of the clinic. Usually, and this is my last and final point, in clinical pastoral education, we live by a belief that we reflect on experiences on the clinic, given our famous phrase, the clinical method of learning. But during this particular age of two pandemics that African American CPE students are living in, COVID-19 and police brutality, how do we begin to bring into the reflective practice thinking about the killing of George Floyd or other highlighted police brutality cases, like case involving our dear brother, Jacob Blake. How do we bring that reflective experience into this CPE unit? Because we know persons of color not only learn from the experiences within the clinic, but must also manage their pastoral identity and their pastoral competency in light of systems of oppression that exist outside the clinic. And so we are encouraging you to rethink CPE in some sense. At Advocate Aurora Healthcare, under the direction of Reverend Marilyn Barnes, we are engaging also in research currently around thinking about racism that African American chaplains experience. We have unfortunately been on the receiving end of many Black chaplains voicing concerns during this time around not only racism that they experience in their personhood outside of the hospital, but racism that they experience within their mission and spiritual care department and the wider hospital in general. And so we are excited about that and more to come.
Okay, I guess I'm after you, Danielle. As I was thinking on these subjects of diversity, equity, and inclusion as a CPE educator, first thing I thought, it took me to my earlier years in the 1990s when I was in my first units of CPE and didn't know about the existence of the College of Chaplains or any other entities besides the extended unit that my seminary required. And I say this required, and I not knowing what that was, I went to Erlanger Medical Center in Chattanooga, Tennessee, to take my first unit of extended CPE. But what I wanna raise in terms of the issues of diversity and equity and inclusion was that at the time, for me, there was no information provided or hinted at any kind of why are you taking this training other than to become a better pastor, maybe in my denomination. I've been an ordained bishop in the Church of God since then. And so I think what I would try to change the story is that it became part of my educational agenda to make sure that all students that come through our CPE programs, and especially those students who I consider to be people of color that may experience the same experience that I had, for them to be informed, to have available information. I remember bringing this up to one of my male Caucasian educators at a center where I was training, and I said, well, I didn't know about this. And his answer was, well, we didn't ask. And so in the learning lesson at that time was for me, okay, you got to learn to ask, you got to learn to be curious, you got to learn to seek help and all that, which I understood. As, of course, they're very basic and important parts of learning, but I also stay with the issue of, I don't ask what I don't know. I can ask help for what I don't even know I need. And so my story, for me was part of helping others, even if they didn't ask, to say, okay, these are some of the opportunities in case you didn't know. This is some of the information. Here is now BCC, even though ACPE is not particularly just to channel chaplains through BCC, but it is an aspect of it, and it's an important requirement. And so I made it my agenda to be able to provide that. To me, that's more of an equity and justice issue for those that were from the diverse background engaged in CPE. Of course, after that, throughout my 7-year process of becoming an educator, the other issue is that it was so difficult to find others in the same career that I was. I remember in the 1990s going to, I think it was in Chicago, and finding one more Hispanic female there in the whole group that we were having CPE. And I remember we started chatting in Spanish, and we were like, oh my God, I'm glad somebody else is here amongst many people that were in this process. And I think for me, that was something that I also wanted to change, to make sure that I became, this is my terminology, an evangelist of ACPE or CPE process to people that otherwise probably wouldn't even know it existed, or they had different notions. As a Pentecostal, I came with the notion that, oh my God, this is such a liberal process, and I don't know if I'm gonna remain true to my theology while I go through this process, which was a real fear for me. And I discovered it's a real fear for many people. And I think Kelsey mentioned that the group of evangelicals and the group of some groups, that people that come to CPE with the basic fears and assumptions that you're gonna have to totally change your theology and be transformed, and maybe even change denomination if you come through this process. So for me, those were issues of mostly of equity and justice. And of course, in terms of inclusion, one of the things we do here, as Danielle mentioned, the curriculum. The curriculum that we offer at CPE is very important because it allows people, even though you may not have a diverse group of students. I'm here in Houston, Texas, and sometimes, you get a certain number of applications. You don't necessarily get all the applications you may desire, and you have to, make selections based on not only on race and diversity, but also based on other qualifications. And sometimes there's not even enough applications to choose more than one minority student or two minority students. And that has been always an issue, but we're strive to do that, and then when we get the group formation, we also strive to provide a curriculum that is actually actualized. If there are issues outside the center, like right now, the racism issues and others, we address them in some part. We modify the curriculum according to what happens. We have an established one, but we also have places where we said, okay, these places are for just in case something needs to be addressed and change in the curriculum. We're very fluid with our curriculum here at Baylor St. Luke's. So those are some of the initiatives. And again, in our daily practices, we practice, for example, a hurdle, a meeting every morning where our residents lead that meeting. And it's we stretch the importance of being interfaith, of being inclusive on those from the beginning. Even if you are an intern in your first unit of CPE, and we model that as we go every unit and every year when we get a new group of students, regardless whether at that particular year we have people of diversity in terms of religion or others. We have a Muslim chaplain, sometimes we have Jewish students, sometimes we don't have anybody other than Christian students in that group. But even when that happens, our hurdles are structured and taught in a way and modeled in a way that people will intentionally be inclusive and think of diversity, even if it's not visible at the moment, even if persons of other religions or other races are not present. I think that's an important piece that we would address in our curriculum. So anyway, that's what I wanted to say for now in respect to this. Thank you.
I think I'm up next. Thank you, Jose. I'll speak first to at UNC Hospitals. As with many hospitals, the fact that there is a disparity in healthcare access means that there's a disparity in access to spiritual caregivers as well, because we're working predominantly in the hospital context. So that larger dynamic affects us without a doubt, and affects the access that students have to our program. That said, we actively recruit for diversity in every way we can in our student population to help build the base of Black, Indigenous, and people of color chaplains, and in terms of our hiring approaches and recruiting approaches, the seminaries that we recruit at, the places that we advertise for positions. Our last staff chaplain hire was another African-American chaplain, and our CEC also an African-American chaplain. And we would love to have more diversity and are actively seeking it. We think about that in terms of our PAG as well. We look to have a range of different religious, racial, and ethnic diversities in our PAG to help give us oversight to our program in ways that with 3 white educators, we recognize that's a challenge for students to identify us as a program where they can experience respect for their racial identity being considered. The program does have a mix of social community settings, including social justice and congregational programs. That's a particular help to our students of color because that lets them do some of their clinical work in congregations if they're functioning as bivocational pastors, which usually turns into trivocational by the time you add CPE into the mix. That's a thing that can be helpful. We offer extended units, a mix of online and in-person education, and we're experimenting with, as we came through COVID, different approaches to when and where and how people are doing their clinical hours. I would say that a couple of other things that are just kind of top of mind. Hospital security is not immune to the dynamics that are in play with policing in the broader societal context, and also hospital chaplains. You know, if you think of those as 2 populations that are subject to implicit bias, I can't do everything I want to do in terms of connecting us with our hospital security, but we are hoping to move in that direction. What I can do is make sure that all of our students engage implicit bias, not only in terms of finding out that that's a reality for them, but then beginning to bring actual technique and competence to bear in terms of how does mindfulness contribute to you being able to take a pause and operate out of an intentional choice, as opposed to out of how that implicit bias may be running. So we're trying to not just educate about the theoretical components, but also to do very practical education about, okay, you figured out that you're white and it's a problem. Now, what are we actually going to do about being able to open up your view of the world as it is and the suffering as it's presenting itself? Our department actually has been very fortunate to be partnering with the Systems DEI organization for over a decade, where people from our department, including myself and other educators and staff chaplains, are actually facilitators for the diversity training program. And when George Floyd and Ahmaud Arbery and Breonna Taylor were murdered this year, we needed to have an intervention in the hospital that went beyond just diversity training. And so we initiated a program called A Space for You, where people from the pastoral care department and the DEI organization partnered to have multiracial teams that conducted virtual listening sessions over WebEx for coworkers. And we've had some in person as well for our food and nutrition services and environmental services folks who don't have easy access to those kind of desktops. We in the pastoral care department have had spaces and people that have been able to partner with the Latinx employee resource group to conduct bilingual listening sessions. And we're taking the comments that people are making there and actually using them to drive what is the next step that the DEI organization is going to put together. And I will say for me, my personal connection in this is, as a white person who's been working toward an anti-racist identity for a couple of decades now, I did not find a home in a congregational setting, and I did not find a home in the academy, and I don't think those things are unrelated. I have found traction in the healthcare environment, and what I find is that the hospital wants to know these things, and the ACPE wants to know about what it means to have an actively anti-racist identity. My denomination, the Alliance of Baptists, also has an active initiative underway that's driving real organizational change. And so I'm grateful for those things, but I also know that I function a little bit as either a thorn in the side of the DEI organization, or maybe I'm expanding the size of the tent a little bit because, you know, adding inclusion of people of color to a white supremacist structure that's not the answer, right? The answer is to go beyond optical allyship to actual white people actually engaging what is our role in ending a white supremacist structure to society that shapes healthcare access. We've seen that with COVID-19. We've seen that with our society's reaction to the brutality that has been visited upon Black and brown bodies for way too long. So I'm both sad and excited about where we are, and hopeful for all of us to be able to continue to get traction in the places where our belonging is the deepest, because I think that's where we can lean in and push the hardest. And I hope we will.
Wow, thank you all for that, just everyone's piece. That was so amazing. And I feel like there's so much richness to dive into. So I encourage participants to think about questions and just ask them in the question box that's on your side. And okay. I think, is my audio still coming through? Or okay, perfect. Sorry, had a slow internet problem. I think I'd like to start kind of picking up on what Tamaria, you ended on, and that is if anyone would like to speak to the role of chaplains or a spiritual care department in partnering with your institution and maybe outside your institution in the community on issues of addressing discrimination, creating more awareness of systemic racism, and creating more equity in your institution or in the community around you. If anyone wants to speak specific initiatives or specific ways that they think chaplains could be part of that.
There is an initiative in our hospital here in Houston that is already working, and I think very well, which I hadn't seen in other hospitals that I've been before. And this is an initiative to address human trafficking issues, which for me, it's also connected somehow with you know, diversity and equity and justice. And I think this program, which is led by one of our previous CPE residents and now a chaplain who looks at these issues not only as a systemic issue and what do we do when persons affected by these tragedies come to our ERs or hospital, but also to provide education for the community into differing settings on how to deal immediately with cases that come to our hospital doors. I think that's a wonderful program that is having a lot of good impact in our community, and every time that this chaplain presents on that, wherever she's invited, there's always a very good response. So I think that, to me, that's just one small example of how an institution can deal with issues that impact the community, and how we can educate not only the community but the clergy and also the chaplains that are already professionals that may be in healthcare institutions and not know what were the first steps to do when you may suspect a case of human trafficking.
I think we would have to back up for a second and make a small note to say that what we really are speaking of is a re-education of what is spiritual care. We would have to re-educate chaplains, CP students, vice presidents, managers, directors to understand that spiritual care is more than simply focusing on the spirit of a being and caring for the spirit of a being, and re-educate persons in our field to understand that spiritual care also, from a holistic standpoint, focuses on also being concerned about the physical needs or social needs that persons experience, and how are we not only caring for spirit, but how are we caring for physical, social conditions that impact person's spirit as well. To that end, one particular issue that I would wish chaplains and CP supervisors would become more acclimated with is is raging and fighting against food insecurity. Most of the health disparities and health challenges that many persons of color, African Americans in particular, face is around an inability to access healthy, affordable food. And so it would be nice if our chaplains, if our certified educators would engage in how do we challenge our local politicians around our hospitals to think about, let us stop supporting fast food markets that are constantly being built in underserved, economically depressed communities in comparison to other communities. How do we begin to engage our local legislation around rethinking is there access to healthy food in our communities? Because many of our patients who are persons of color and unfortunately are poor come to our hospitals because of health conditions related to poor food choices. So I think food insecurity is a huge issue.
I'm piggybacking off of what Danielle said. I think about the social determinants of health, right? Which includes where people live, work, learn, play, and receive their health care or don't receive their health care. And I know the World Health Organization doesn't include where people worship or pray or their spirituality, but I always add it. So I think that as chaplains, we also need to be included into those social determinants of health and thinking about food insecurity, the anxiety that people of color have with going to receive healthcare, that trust, right? We know about the Tuskegee experiment and what happened with the federal government and that. And so when we say for the COVID-19 trials that only 40,000 of the 300,000 needed are people of color, well, what do we expect when we don't have that trust? And I think that chaplains can expand to broaden to help with that trust and to help with that education, and not from the perspective of a dominant culture, but from a perspective of looking at a person, body, mind, and spirit.
Does anyone else want to add anything to that question? If not, I'll move on. Thank you. We have some questions going back to Kelsey and Marilyn's study of the demographics of chaplains. One is about if anyone has looked at the success and fail rate of African American students in particular, and maybe other people of color students. And I know that some of you have also spoken about ways that we could actually improve curriculum to help attract more students and also help educate students. So maybe if Marilyn and Kelsey, you could speak about that aspect of your study, and if you thought there were any things that were particularly successful, or maybe reasons why not as many students we see that result in staff chaplains.
So I think one of the biggest challenges with what we presented to you is that it's a really nice, really blurry snapshot. And, you know, we can't make any assumptions about how people move from training into chaplaincy. And we can't make any assumptions about demographics as related to fail rate. And the biggest problem from, I think, our perspective is the lack of adequate data. And that burden doesn't just fall on the professional organizations. It falls on all of the ACPE centers, all of the hospitals. Now, this is not just a problem that's unique to chaplaincy. Know that too. It is a problem that plagues allied health. It's a problem that, as you could watch on the news, plagues tracking COVID-19 numbers. And so, in terms of knowing if there's any trends in African American certification, either successes or failures or areas in which folks struggle, we can't speak to it. I can say that in helping with a study recently about certification that lacked the perspectives, and hopefully you all will be able to read about this thing, that really lacked the perspectives of non-white or any other type of demographic minority perspective, we just don't know. So it's hard to kind of hypothesize in that direction. But at the same time, when research has historically in the United States taken advantage of and really abused and hurt minority populations, like the missing information is not surprising either. So that's what I would say about that. I don't know if anybody else has anything else to throw in there.
I would build upon what Danielle's mentioned about the study that we're looking at with a few other healthcare systems, is to look at answering the question, is there systemic racism in chaplaincy? And to talk about the movement from becoming a student and being admitted to a CPE unit, moving from CPE to getting a position, from a position to board certification, from board certification to being a leader within one of the board certification organizations. And so those are some of the questions that we're thinking of as we're looking at developing this study to actually, as I said, answer that question, is there systemic racism in the vocation of chaplaincy?
I think in addition to what Marilyn is saying and what Kelsey has said, I think it's also important to ask a reflective question for the person or persons who ask this question. Is I'm always lamenting the number of African-American certified educators in particular systems and institutions. When we talk about where are all of the students of color, we have to first ask ourselves, where are all the certified educators of color, right? You attract usually who you are. The CPE program usually attracts whatever is the demographic makeup of the certified educator. And so I think that that's also a small caveat to pay attention to as well.
I hope we can get to the point where we're framing the question differently, not is there systemic racism, but where is the systemic racism? Because the fish are all swimming in water. You know, we are functioning in a white supremacist society. So the question is to look at where is it, how is it showing up? And if you know, what you measure is what matters to you. So, I mean, this is a thing that I experienced a few years ago when I got curious about what the demographics were of people moving through the process, and it wasn't being tracked. And that was shocking, because that tells you that it doesn't matter to you, or that you don't want to know the answer to it. So I think we have to look with some epistemic humility at what are the knowledges that we have valued and why, tied to what are the goals we're trying to achieve. And that's gonna, I hope that's gonna be a sign of the deep change that we're trying to live into. And it will take active resistance every step of the way to the way things are, because that's shaped by effects that are not what we want to achieve. We want to achieve racial justice, not just add color and stir.
I wonder if part of the solution could also be targeted initiatives like, you know, the universities have that we may not have in our educational CPE system, which is, you know, grants that target a certain population and that provide those additional resources. I remember when Danielle was giving her earlier comments about some students that had to work 2 jobs plus do CPE. I remember those days when I was pastoring a church and doing CPE, and the certification committee kind of going back to, you know, how are you going to keep your passion, how are you going to concentrate on your CPE process as becoming a supervisor with the responsibilities of your church. First of all, what they did know is that what the church was providing for me financially was very minimal, because it was a very poor congregation, low income, so their offerings and tithes were not enough as a salaried pastor. And the second piece was that, you know, again, what the hospital was offering me was also still at a stipend level. As those of you that have gone through certification, you don't start making a professional salary until you are actually certified. So those aspects at that time for me, if we had been some sort of grant to say, okay, let's all apply for that, and it's targeted specifically for those very basic needs, which is just simply to provide for your basic needs. I was fortunate to have been married to a professional nurse who supplied most of the salary that the church and the hospital didn't supply for me. But not everybody is in that particular case.
So I'm trying to weave together a question. I think some of what we've talked about is about increasing the diversity of demographics of people who are studying to become chaplains and who become chaplains and are educators, and different ways to do that. And then at the same time, we're talking about a greater vision of spiritual care. And, you know, really taking Tamari's point about not adding token faces of color just for the sake of doing it, but really transforming our vision of spiritual care and what it can be. And I think there's lots of questions that kind of come up about why we're doing this. You know, is it because we want chaplains of different identities to be able to serve our diverse population? Is it because we want to help with the overall lack of equity in our society, especially in healthcare? So I wonder if each of you could maybe speak to what you hold as that vision of chaplaincy of spiritual care, and how we can move that vision forward to meet this moment.
I think one thing that I would respond to that question with is, it comes out of the same reason I was so happy to see Sonia Sotomayor come onto the Supreme Court, because there's an epistemological privilege that comes out of the lived experience of Black, Indigenous, and people of color in our country. They live in the real reality, they see the real reality, and they have the real wisdom that we all need, but don't have, to live into the real reality that we're all facing. And it's not enough to care for the wounded when you can do something about the wounding. And the structural changes that are needed to stop the wounding is going to come out of communities of color who've experienced the deepest impact of that. And so I want for these people to be in leadership everywhere I look, everywhere I turn, including chaplaincy. I want to be able to be in active followership to the very real wisdom that these folks are going to bring. The people who know how to survive and thrive in the current conditions are the ones who need to be leading us out of the current conditions, because their vision of what is wholeness and what is health and what is humanity is more complete than mine. I'm clear on that. And so I want to be in active followership in every area of my life. And I find the deepest brilliance among women of color because they face the deepest depression.
I will say, my hope is that professional spiritual care becomes a public health discipline, a more central public health discipline.
I would say that my hope is that as much as we place emphasis on educating our spiritual care providers on the competence of being interfaith and to be able to minister to different spiritualities, to also provide an opportunity for the future chaplains to be as competent as dealing with culture and race and other issues related to diversity, not only faith.
I would offer in the midst of COVID-19 that people don't know they need a chaplain till they need a chaplain. And right now, a lot of people need a chaplain and want a chaplain, and not in the traditional sense of always someone to pray with you or to offer you scripture or anything along the religious line, yet as a companion on this portion of the journey so that people know that they're not alone. And so I think that as the research that we talked about, that Kelsey and I shared, when you have persons between 45 and 65, we're at different positions in our life. And we know that younger generation, we see are less religious and more quote unquote nuns. And we need to be able to be inclusive from a persons of color, diverse from persons of color, sexual orientation. We as chaplains need to step out of our religious walk and embrace being that companion for the journey. That's my vision.
Well, thank you all so much. We are going to wrap up, and thank you all for offering that vision. That was really inspiring, and thank you all for sharing your research and your work with us. And I hope that this will produce many more conversations for us in our departments and institutions and nationally. So I'm going to turn it back to Michael to give us any extra technical tips and say what's next.
Thank you. Thank you very much, Christina, and our entire panel. Christina, you mentioned sharing your research and your work with us, and just so much has gone into getting all of you to this point, and I'm so grateful that you have shared all of that with us, whether it is down in the trenches research like Kelsey and Marilyn have talked about, or just a career that's full of this wonderful variety of experiences that has helped you all be leaders in your fields today. So thank you so much for sharing that wisdom with us. I'll remind everyone that this has been recorded, and so you will get a link to that in the next couple of days. It takes us a couple of days to sort of polish this up and get rid of the, all of us looking at our webcams at the end of the webinar and things like that, but you will get that recording in the next few days. I want to encourage you to look at the Chaplaincy Innovation Lab website for our upcoming webinars, chaplaincyinnovation.org. We have one coming up on September 22nd that has to do with what we call the demand side of chaplaincy, and how can we identify areas where there is a greater need for spiritual care, and how can employers begin to address some of those needs. So that's what's coming up for us next. Please do be with us there and sign up for our other webinars as well. And then one final thank you to Cedars Sinai for co-sponsoring this webinar with us. Thank you, Christina, for being with us. Pam Laser, who I think is probably out in the audience, isn't up here on the panel today. Thank you for joining us, and we will see you all next time. Have a great afternoon. Bye-bye.